Hello and welcome to HFMA Talk, the podcast for NHS Finance. I'm Lisa Robertson, a Policy and Research Manager here at the HFMA. In this podcast you can hear the full conversation had on financial reporting and accountability arrangements. This is a supplementary episode to our main episode on the introduction to finance as the Health and Care Act comes into effect. As introduced in the main episode, I am joined for this conversation by Zoe Petrarch, Sheila Stenson, Lee Outhwaite and Nikki Briggs. Can I ask you to kick us off by taking us through the financial reporting requirements?
An ICB will have a statutory duty to break even at the end of each year, and that's also an ICS duty as well. So the ICB, as a result of that, will need to prepare an annual set of accounts and an annual report, and they'll need to do that to a specific time frame and by a specific deadline. And those annual accounts will be consolidated up to national level and will eventually be laid before Parliament. So that's kind of the route. Before those accounts are consolidated, they need to be audited, again within that specific time frame, and they need to receive an unqualified opinion. So good value for money and an unqualified on the audit opinion. The board's role in this is the audited accounts and the audit opinion will be presented at an ICB board, and the board will need to approve it and sign it off. The other thing I would say is that the ICB board should have an overview of finance throughout the year. So when they're presented with the accounts at the end of any financial year, the position shouldn't be a surprise to them at all. They should be very aware of the financial performance of the ICB, but also of the system throughout the year.
Sheila, can you share your thoughts and experience on the financial reporting requirements?
The key things for, any audit committee stroke board's going to be the annual accounts, the annual report, which kind of tells a story of what the trust has been delivering in year, which obviously once you finish the annual report, you append your annual accounts to. And a key part of that is the annual governance statement that's been kind of drafted by the chief exec as the ultimate accountable officer that sets out kind of, any key concerns or anything that's come up during the year. So for a board member, if I think about what I take to my board meetings, a really kind of high level summary finance report that talks the board through where we are, which is obviously going to cover all of the basic things around how much we're spending on pay, what we're spending on non-pay, depreciation, for example, but also just tracking how we've set our budget. So what's our monthly spend against budget and what are we utilising on a kind of year-to-date basis as well. So we've got a really clear audit trail. So pay might be broken down in kind of a little bit more detail to how many permanent staff we've got in place, so our substantive headcount, what we're using on bank, what we're using on agency. And I think agency is going to be a topical one this year as we all kind of look to think about what can we do differently to try and reduce agency spend. So I think absolutely all of them things are key components. I think the other thing that my board in particular has been interested in is what's our underlying deficit and what am I doing as a finance director to reduce that. But also how are we delivering efficiencies, and them two obviously massively kind of linked together. But the efficiency ask on the NHS is really large now. So I think that's going to be even more and more prominent in board papers as we move forward. We've got a kind of standard integrated quality report, which includes kind of quality and safety and also includes our performance from a perspective, which is performance in terms of metrics around our waiting times, but also performance from a finance perspective and performance from a workforce perspective. So we've got a report which is quite holistic, which goes to our board every single month, and it's a particular focus that we have on the agenda, and we work through that as a board collectively, trying to tie up the issues and think actually what we're seeing over here with a number of vacancies, for example in medics, is having this impact on our performance in these particular community teams, and therefore it's having an impact on our agency spend. So it is that kind of triangulation piece that we use our kind of integrated performance report for. So, and I think, many trusts have them in place, and, that's what they use to kind of, triangulate their data and think about, and come up with plans to be able to move things forward. So I know that from our audit committee, the Ned that chairs our audit committee is really keen for me to bring things to that committee that talk about kind of some of the financial management issues we're seeing as a system, but also some of the governance issues we're seeing as a system. This is all evolving. So actually he wants me to give them a quick heads up so they can consider from a risk point of view to our organisation all of the changes that are kind of happening and how we feed into them. So obviously for year-end accounting, we always have you know, an audit committee, as you would expect, but actually we have 3 audit committees, which actually can sound quite daunting when it's a year-end process, but it's really a really supportive approach. It goes back to that key role in Ned's play. So actually our chair of the audit committee likes to have the very first kind of audit committee, which is just myself, key members from my finance team, and the non-execs that sit there and go through the draft accounts that we're submitted, so we can just have a kind of page turn. So he's really keen or clear and understands the kind of key movements, and they can ask any questions they want. We then have the kind of formal meeting where the auditors join and we talk through the draft accounts, and then actually just kind of any things that are we bringing to the table that makes sure the audit committee are aware of. And then we have the very final, which is when we've got to the point when the audit's more or less finished, and we're having a discussion around the final accounts, ready for the audit committee to approve them and recommend them to the board. And that's been something we've been doing for the last kind of couple of years. And then the board will obviously sign off the accounts as the kind of ultimate accountable board for them.
And Lee, I know you've been thinking about this. Can you tell us about what financial information the board should be expecting to see?
There's some nuts and boltsy stuff that you would expect to see if you did some financial diligence on an organisation, which would look quite conventional about money coming in, money coming out, on what, cash balances, debtors, creditors, all that other good stuff that's self-evident that we're going to need in each ICB, which helps with that overall financial standing assessment. What I'm getting more interested in, however, from a sort of board oversight perspective in the ICB is, how could we think quite differently to that which we've conventionally done about some of our financial reporting, particularly framed around a concept of failure demand? Where are we consuming resources in the health and care system because we haven't got patients and citizens to the right place? And how would we describe that? So to what extent might I have better primary care access in Rotherham compared to Barnsley that's enabling lower general and acute bed use because I might have a better outreach service in one conurbation than another? So I think there's something for new board members in the ICB, but also in the rest of the health and social care system, being really ambitious about what's the different sort of financial information we want to see now that really enables us to understand much broader definitions of healthcare value, and does delivering services in the right way, as close to patients as possible, as responsibly as possible, which I think needs us to give us quite different looking financial reporting. There's a nuts and boltsy stuff about the money coming in, the money going out. We got cash, debts, creditors, all that other good stuff. But I think there's a real need to describe very differently some of the core financial and broader performance data you'd need to say to make claims about how well is this integrated care system operating compared with another one, and what are those key markers of that stuff? Because I don't think the purchaser provider split has enabled us to do that particularly well. About this area's got a really good community service that, as a consequence of it, is resulting in less general and acute access, which is overall better and more cost effective, or this area's got a really good primary care response to this chronic disease, which means less people are polling up into hospital. We're not awash with that sort of data, but it's the sort of data we need.
And what about meeting the financial duty together?
I think it's really interesting because actually the ICB can't actually deliver anything on its own. It has to be able to deliver through statutory organisations. So it's very much a collaborative approach that needs to be taken, because, as I said before, there is contracts and contract mechanisms, but that's not going to drive, a collective understanding of the financial performance and financial targets. So I think how we need to meet that, there's openness and transparency is number one, and having that kind of real clear, almost board to board reporting, and clear understanding of not only what the system is allocated in terms of funds, but where the system money goes. It goes back to that, what's the system pound and how is that spent? Regardless of almost organisations, but what's that being spent on, and how's that facilitated? And then it's very quickly when issues or opportunities arise, how is that being brought up and outside of organisations into the system space, rather than it landing at a quarterly report or at an end of year, and how we can work across systems to be able to mitigate organisation performance. So I think that is a real opportunity that that other partners around the table can support in mitigating any potential financial pressures or sharing in the opportunities that there might be as well. What we've got to really try and avoid is becoming a regulator of partners around the system. So what you don't want to be seeing is every organisation's individual detailed finance committee performance. But what you want to, I think we've got to get to a place where we start to have system level reports. So yes, it's an understanding at organisation, but it's that real a system level. How are we spending money on the acute sector, which will include independent sector, not just one or two by provider? How are we getting benchmarks at a system level? How do we start to understand transformation elective at system level, not just for each of the the key providers around the table when it comes to spend, at workforce? What's the workforce as a whole look like across the system? So yes, there's an element of having to escalate and understand each organisation's performance, but I think that critical for me is how do we start to really develop those system level financial information packs that really start to then be able to benchmark it against other systems, but also truly understand where money's being spent. I think two key things for me, if I was a board member, I'd want to know where the money, where we were resourcing on a trend perspective. So, the long-term plan talks about left shift, but actually over the last 4 or 5 years, when you look at it, have you seen above inflationary increases in the acute sector and actually lower than inflationary increases in your community sector, which is saying the opposite to what your strategic vision and everything is. So it's how do you, in financial terms, really understand whether you're getting to the heart of the things that strategically and operationally you're saying you're wanting to do. I'd also say at the minute, given the sensitive nature and the political focus, elective would be something as well from a financial perspective you'd want to be keeping a really close eye on, and obviously the key drivers of the the finance is the end product. So it's those kind of workforce numbers, those efficiency opportunities, and really where the system is has potential to improve further.
Thank you for listening to HFMA Talk and this supplementary episode to our main episode on the introduction to finance as the Health and Care Act comes into effect. Don't forget to subscribe to this podcast to keep up to date with new episodes.